Assalamu alaikum. We are now live on the ISD Facebook page. You may begin.
Assalamu alaikum. This is the third presentation in a series about describing COVID and more lately about the vaccination and different vaccinations. We are very privileged to have Dr. Shahnawaz Khan present all these three times. He's very knowledgeable, very likable, and quite a few of our community members over the years have benefited from his expertise. As most of you know, that he has two offices, one in Elkton, outside of Elkton, actually Chesapeake City, and the other one is right here on South College Avenue. One thing that I really appreciate about Dr. Shahnawaz Khan is that he treats everyone who comes into his office as his own family member. One of my neighbors, a new neighbor, asked me for a primary care physician. And when I recommended his name, I said, over the years as a physician, I have seen what people really complain is that the doctors do not have much time. They do not explain things well. That is not at all Shahnawaz Khan. He's, if anything, very different. He always takes his time and explains, and that's why he's becoming more and more popular. So quite a few of you, I understand, have attended virtually his earlier two presentations. And I'm very grateful to him that a couple of weeks back when I said, Dr. Shahnawaz, things are changing. Now we don't only have two vaccines, but the third one is approved, and it may already be used in Delaware. He surprised me with his latest knowledge, and he said, oh, it's being used already. And then now people are talking about the fourth one. So he will give you all those details. If I could say that, and Shahnawaz, in a loving way, that in community we consider you are Dr. Fauci. So
thank you.
It's all yours now.
All right. Thank you, Jazakallah, Dr. Salim, for such a generous introduction. I'm humbled greatly. I was asked back a long time ago about doing these COVID lecture series for community members so that they can have updated knowledge about this virus. And then, as the time progressed, we learned what we have in our arsenal to combat this disease process. And with that knowledge, we were able to, I was thinking it would help people in making much more knowledgeable decisions about their health, because we all are a community and we're all trying to keep each other healthy and safe. So having this knowledge, you can make a better decision about your health, and in turns also with the community and your loved ones too. So I hope this lecture finds it for all of you guys to be knowledgeable, to give you knowledge about dealing with the COVID-19. And currently we're dealing with a lot of vaccination questions. So I thought it'd be we can do like a little bit of updates on, since the third COVID vaccine has been in the horizon going on. So like I said, this topic includes COVID-19 vaccine and its updates, myths that's floating around in the community, and what are the facts about these vaccines that are available. So with due, I'm going to start. So a little quick content that we're trying to see with the vaccination, that what is COVID immunity, what is active immunity versus passive immunity, what roles do vaccine in play in developing immunity, type of vaccine that are available in the US currently, then vaccine myths, vaccine facts, future vaccines, and then current state recommendations about these vaccines and the resources to acquire these vaccines. A little bit of intro, and the original virus was a novel coronavirus that was discovered in Wuhan, China in 2019, and since then globally, it's been wreaking havoc in people's lives, and we have lost so many lives due to that. And currently, it's becoming a little bit more dangerous due to recent mutations that includes the UK coronavirus variants, South African coronavirus variants, and then the Brazilian variants. All these variants do affect us differently, by some with increased infectivity and by some increasing the resistance against the vaccine. So if we can't get everybody vaccinated, there might be a time that we may not be able to use these vaccines because the rate the virus is mutating in our community. And some facts, you can see how much it has affected worldwide, United States, and then our state of Delaware. All these data have been gathered from World Health Organization, CDC, and Delaware.gov. So these are all authentic numbers, but you can see the mass scale this virus has created so much problem for us, including deaths. So despite vaccination, still CDC is recommending to wear masks, stay 6 feet apart, and avoid crowds if you can. And the state of Delaware also has guidance about who should and how to wear masks, and who is supposed to keep it on all the time. So usually, as you can see, ages 2 preschoolers basically encouraged to wear a mask, but not, however, if they can't, it's not required. However, people above 17 are required to keep their masks on all the time, because even if they're not symptomatic, they may be asymptomatic carrier, which can increase the infectivity to the others who are more vulnerable in the population or community. So please do wear a mask. So question is, this is virus going on, how do we get tested? So most of the testing in the Delaware is free. So do get your testing done. This is straight from state website. So you have this website at the end. As you can see, you can log in there and find out what facilities, what pharmacies are offering these free testing. If you do find these helpful, please do go to these facilities and get yourself tested. If you're symptomatic, do go to these facilities to get yourself tested so that you can keep yourself quarantined before you can infect anybody else. What testing is available right now? The antibody tests are the ones that are being offered. Usually there are 2 types of antibody tests that is available. One is RT-PCR, which is very more accurate than the rapid antigen test. The rapid antigen test will give you a result in 15 minutes to 20 minutes, so that you don't have to wait. But the thing is that it does have some false positives and false negatives claims. So if you do have a false positive or false negative and you think you still have symptoms that are kind of concerning of corona, do get RT-PCR tests. So for high-risk patients or highly symptomatic patients, certain facilities are offering both tests at the same time, given that the RT-PCR is more accurate. But however, it does take a little longer for the results to come in. And if you think you're symptomatic, please do stay home after getting these tests done until you get the results of the RT-PCR, so that in the meantime, while you're waiting for the test result, you won't infect anybody, and also your loved ones too. So be advised that these things are for everybody's protection, and by doing or following all these cautions, we can save our loved ones from getting infected. So get your testing done to get checked out. So coming up to that, what is available today to combat COVID? And there's some medications like remdesivir that actively treat COVID-19 infection. That is if you already got the infection. So that's how we combat it. However, vaccines and serum antibodies that are also available in our arsenal do provide a certain benefit in a sense that it creates immunity. I'm going to talk about immunity, what is immunity in next slide. However, vaccines do give you a lot of effective prevention by creating antibodies. However, serum antibodies that you inject are passive antibodies, and their effect lasts short term, so you don't develop a long-term immunity by getting serum antibodies. However, they have their own place in promoting some safety in high-risk patients who can't get either vaccines or they are in an area that is high risk for catching corona. So I would recommend those people to also seek out with their providers of primary cares or hospitals to see if they can be eligible for serum antibody passive immunity injections. So talking about active versus passive immunity. So vaccines are not, again, I'm going to say, are not for the treatment of active viral infection. They are usually are good to create future immunity. So that means it is very important, future. So you're not treating a virus with this right now, but however, you're arming yourself with the vaccine and creating in your body, in a sense, antibodies that can prevent you for future infections. They do take time, and depending on your health status, usually the response is different for everybody. However, if you do get your shots in time, these response can be pretty much as it's been seen in the clinical trials of these vaccines. If you think you can't get to these vaccines in time and you're high risk, do reach out to your providers to see if you can be eligible for passive immunity, which can buy you some time until you get your vaccines. So a lot of people last time after the discussion asked me about how do these vaccines work, and I thought maybe I'll add one slide in this presentation to just show that how these vaccines actually help us build immunity. So usually, since we have 3 vaccines, 2 of them are mRNA vaccines and Johnson & Johnson, one is a viral vector vaccine, there's a little bit difference in how do they achieve. However, none of these vaccines use live virus. They use a piece of virus or coronavirus mRNA to trick our body into creating antibodies. So these proteins that we use from these coronavirus to trick our body are called spike proteins. So if you see in the literature and you don't know what spike protein means, it's these little pieces of coronavirus that we use to enhance our body, enhance the antibody production for the virus with these spike proteins. So you can read later on with this slide. I'm not going to go too much in detail. Currently, what is available as vaccine in US? So our beloved ACIP, which is Advisory Committee on Immunization Practices, they usually are the one, along with FDA, approve these vaccines. And currently in US, not in world, only 3 vaccines are available. A lot of people already talking about AstraZeneca, but it is not approved in US yet. So Pfizer, which is 95% effective, recommended for 16 years and older. Moderna, which is 94% effective, it's for ages 18 years and older. And then the newest one that's been approved is Johnson & Johnson, which is about 66% effective, and also recommended for 16 years and above. So children and adolescents that are outside these ages should not get these vaccines because it is not recommended for them. So anybody who is 16 or 18 years above should be eligible for these vaccines, given the conditions I'm going to tell you in certain special circumstances that they can be eligible. However, at this time, the Delaware is only asking for 50 plus years for the adults to get their vaccination. All right, so going up to each individual vaccine, Pfizer, which is BioNTech by the name, it's a 2-shot series and it's 21 days apart. So you need to get your shots 21 days apart. One thing I do want to mention in the beginning for all these vaccines, when you do get these vaccines, the state that you're getting these vaccines is going to give you a vaccination card. That is very important. Do not throw it away in a trash or put it somewhere where you can't reach it, because these cards will tell you the date, the lot number of the vaccine, and what type of vaccine that you received. Right now, because a lot of people think it's just a piece of paper, but it's a very vital piece of information that can allow other healthcare providers and your provider to figure out what they need to do to help you best in vaccination events. So going back to that, Pfizer's 2-shot, 21 days apart vaccination, it was the first one that was approved by the FDA on an emergency basis. It is 95% effective. It is an intramuscular shot, and it's recommended for 16 years and older. Now, it does not contain any eggs, preservatives, or latex or pork products, as a lot of you were kind of concerned about that. It does have polyethylene glycol, which is a product that does not have any pork or any product that would affect if you are religious about it. And the thing that we are most worried about vaccine is the reaction. So people who have allergic reaction to these vaccines should not be getting these vaccines, or at least consult with your primary care provider or the vaccination provider to see if you can get the second shot, especially if you did get a severe reaction first time around. Usually the treatment is EpiPen, which is most commonly available at the emergency care or at the vaccination events by the EMT staff. So they do carry EpiPen, which does help decrease the allergic reaction of these shots. Common side effects with the Pfizer vaccination is pain, redness, swelling, headaches, muscle pains, chills, fever, nausea. They usually, last a couple of days. However, they can last a little longer based on how your health is. Like I said, it is 95% effective, and however, it does prevent a lot of serious effects of the corona infection. Second one, which is the last one, the Johnson & Johnson vaccine. It's only a single shot. A lot of people been raving about it because it's just a one shot. However, it does, out of 3 vaccines, has the least amount of effective prevention, as I'm going to talk about this in the next slide. It is also an intramuscular shot. It is for people 18 years and older. It does not contain any eggs. So if you have egg allergy or, like in flu, you still can have this vaccine. It doesn't have any preservatives, and also does not have any latex in that, or pork. So same thing with this. People who have severe allergic reactions, the main ingredient in this vaccine is polysorbate. Some people are allergic to that. So people who have allergies to polysorbate or any of the components of this vaccine should consult their healthcare provider or vaccination provider if they are eligible to receive this vaccine. However, if you don't have these allergies, please do get this vaccine, because given the lack of availability of all these vaccines, it is harder for people to protect themselves. And anything you can get, it's better than not having any kind of protection. So most side effects with the Johnson & Johnson vaccine, and it causes pain, redness, and swelling in the arm at the site of the injection. However, it also does cause general body side effects like fatigue, malaise, tiredness, muscle pains, chills, fever, and nausea. Side effects usually starts within a day or two of getting the vaccine, and might be severe enough to affect your daily activities, but should go away within a few days. So how well this Johnson & Johnson vaccine works? Since it's only a single shot, its effectiveness is only rated at 66.3%. The clinical trials showed that the people who got this vaccine has had a less severe disease process, and it prevented a lot of hospitalizations and deaths. So even though it is least effective out of all the 3 vaccines, it does have a role in creating immunity and also lowering the effect of disease process on the body. Now, the third one, Moderna. So it was the second one that was approved by FDA on an emergency basis. It is also a 2-shot, 1 month apart, usually 28 days apart. And it is also intramuscular shot. People usually 18 years and older are eligible for this vaccine. And it also does not contain any eggs, preservatives, latex, pork products, or glycerin. So people with religious who follow religiously about their diet, this should be okay. Again, who should not get this vaccine is the people who are sensitive to prior immunization or vaccines, especially the first shot, or who had the sensitivity to other vaccinations in the past, or develop an allergic reaction to the Moderna first shot. Second shot should have gotten after talking to a healthcare provider. It is also made with polyethylene glycol, so it is also safe for people causing any severe allergies. Side effects of Moderna, same like before: pain, redness, swelling, and the local area where you get the shot, and also throughout the body where you can get tiredness, headaches, muscle chills, and fatigue. They also, again, starts within 1 to 2 days of the vaccine, and they can subside after a few days. So how well this Moderna vaccine works, like I said before, it's 94.1% effective. And usually it is very effective in preventing not only the novel Corona-19, but also its variants too. So both Pfizer and Moderna have shown in clinical trials to be very effective against variants along with the Corona novel and COVID-19 virus. So please do get your immunizations as soon as possible so that we can all be free of this disease, which has hounded us for a long time. A lot of buzz about AstraZeneca and Oxford vaccines. So I thought maybe I'll put a slide in to discuss about that. It still has not been approved for use in United States. However, it has gotten a green light from European agencies. So in Europe, it has gotten a green light its effectiveness is only 70% compared to the other ones like Moderna and Pfizer, which are 94 and 95% effective. However, the biggest concern that it took for European agencies to pass it is it causes blood clots and pulmonary embolisms in certain trials. The other thing, the effectiveness was also riddled by their very complicated trial. So the trial on AstraZeneca was still the way it was done. It didn't make a lot of sense to a lot of scientists. So that's why it hasn't been approved in the U.S. Up till now. However, they are going this July for approval with the FDA, and so keep your fingers crossed. See what we find out from that. There are some future vaccines are still in the pipeline, and there's a lot of people or companies trying to see if they can have a saying in COVID-19 prevention. As you can see, these vaccines have different types of vectors and different ways they can attack or create immunity against the COVID-19. Currently, Russia, China, and India have their own vaccines for their own country, and few other countries that they have been authorized to sell. However, it's still in a process, and in US it still has not they haven't gotten any kind of approval from FDA. So if you're out there in a different country, these probably might be your only options available because of the limited supply. Like I said, again, AstraZeneca approval has gotten by the European but not by FDA due to the pulmonary embolus and blood clot risks in the trials that were done. So the question comes in, once you get the vaccine, what are other things that we need to know about vaccine, that if we're getting it, what do we get any other vaccine or booster and stuff? So there's still a early enough, and there's still lack of data about the safety and efficacy of these vaccines. However, if you are getting this vaccine, you should not, again, I'll say, you should not get a vaccine 15 days prior or after these vaccines, regardless, because even if you're getting a Johnson & Johnson one shot, you still have to wait 2 weeks after the vaccine to get any other vaccine, like a flu vaccine, or you have to get so you have to get these shots after you get the other vaccine 14 days later. So there should be a 14-day gap between any other vaccine and corona vaccines, regardless of which one you're getting. There's no need for a booster, and a lot of people talk about what is available for booster. However, at this time, there's no booster or for after you get the vaccines. There is expected that you will develop immunity from these vaccines. So vaccination of person with a COVID infection. So usually it is not recommended to get a vaccine while you're actively having a COVID infection. Usually you have to wait after your quarantine time, after you've done with your COVID infection, to get your vaccine. Since the supplies are limited, also these persons may want to wait about 90 days after they got the infection to get a vaccine, to allow other people who hasn't gotten an infection and are more at risk because of the limited supply of these vaccines available in this part of the region. So a person who previously received passive antibody therapy, usually also a lot of people who have gotten this, there's no safety and data about, with the vaccine available because it's too early. However, if you did get a passive antibody, serum antibody therapy, you should wait about 90 days to get your vaccines. There's no recommendations for minimum interval between other non-COVID antibody therapies. So you can still get those therapies without having to rely on the 90-day data on passive antibodies. Some important facts about the vaccines, like COVID-19 vaccine will not affect the result of your COVID testing. So if you think you got a vaccine and you're showing symptoms and you want to get tested, you think it's going to be positive because you got the vaccine, that is absolutely a myth. There's no relevance of testing and vaccine affecting the testing results out there. COVID-19 vaccine is acceptable in Ramadan fasting. So I had to research that. And from various sources, I found out that even if you're fasting, you still can go get your vaccine done. So there's no excuse during Ramadan that, oh, it's because I'm fasting, I can't get vaccine. You can get those vaccines. Does not interfere with any tuberculosis tests. So if you're applying for a job or for daycare or for any reason you need a tuberculosis test and you think, oh, I got my vaccine is going to be positive, that is not correct. So tuberculosis test does not get affected by vaccination. The other thing I do want to mention that when you go to a vaccination center, you don't have a choice in which vaccine you want to get. Usually whatever is available, they will give it to you. It's up to you to decide whether you want it or not. But as of right now, you don't have a choice in saying which vaccine you should get. COVID vaccines are not made from natural rubber, latex. They have no indication, like I said, no gelatin, pork, or any preservatives. So please, I'm going to repeat that again for a lot of people who missed out on the first time. And they're made from polyethylene glycol, and in Johnson & Johnson cases, polysorbitol. So those are the things that are least allergenic, I would say. So some concerns about if I have already had COVID-19 and recovered, do I still need the vaccine? And the answer is yes, because even though you recovered from COVID-19, there's a lot of variants out there which can still infect you. And then once you get infected, you become a carrier and you can infect other people. So having vaccine would keep your disease process at the minimal and also keep you from getting too much infective. Due to severe health risk, COVID-19, the reinfection is a possibility. However, it is rare, but it is a possibility. And we don't know how long after the COVID infection somebody has antibodies. That's based on their health status and age, that how much immunity they build from actual infection. And same thing with the vaccine too. Some people say, do COVID-19 vaccine alter my DNA since it's called mRNA vaccine? The answer is no. They do not change your DNA in any shape or form. Is it safe for me to get a COVID-19 vaccine if I should? I would like to have a baby one day. That's for pregnant women, and the answer is yes. Do the COVID-19 vaccine protects me from getting sick with COVID-19? And the answer is yes, but there is a caveat to that depending on what time you get exposed to COVID-19, because right as you get the vaccine and you start developing symptoms of, or you get exposure of COVID-19, your body didn't get the chance to develop immunity by that time. Usually 1 or 2 weeks after that, you can have at least some immunity build up. However, right off the bat, after getting the vaccine, you still don't have the immunity build up at that time. So be mindful of that. Do any available vaccines contain live viruses? The answer is no, because they're all killed. Like I said, put it in the slide, Johnson & Johnson has a genetically engineered viral vector and does not contain any live virus. Moderna and Pfizer. AstraZeneca has a weakened version of the virus that they use. So that's kind of a little bit different than the other three, but AstraZeneca still has not been approved in the US. So at this moment, we don't have to worry about this right now. Do I need to take any medication before or after the vaccination? And the CDC says you don't have to take any medications, even over the counter, like aspirin, ibuprofen, or Tylenol for the vaccine-related side effects. However, if you do get malaise and stuff and you have a little fever, you can take a Tylenol or ibuprofen at that time. However, preemptively, you should not be taking that or any antihistamines too. Again, you don't have any saying in what vaccine you want to get. It's basically depending on what at the event where you're getting it, whatever they have, they're gonna give it to you. So be mindful and don't argue with the health workers or the vaccine administrators that you want this instead of that. It is not mandatory, it is recommended, so it is your choice whether you get it or not. However, I do recommend that you do get it, because not getting it is has far worse severe consequences than getting getting it. So stay safe and healthy and get your vaccinations. Again, question came in about how long do I have to wait? So usually they say 10 days or at least your isolation period is over before you're getting the vaccine, if after your COVID infection or being COVID positive, whether you have symptoms or not. So right now recommendation is 10 days or you finishing up your isolation time to get your deal. Same thing with the antibodies, that you should wait about 90 days before getting a COVID-19 vaccination. So if you're not unsure about these things, please do talk to your healthcare provider so that they can update you in about what is available and how you should proceed with the vaccination. So there's a big questions about people with underlying medical conditions that they already have a weakened immune system, and should they be getting vaccines or they shouldn't, because there was a big myth about that vaccine might have a live virus, which already discussed it in the previous slide, that vaccine does not have a live virus. So given that, and given the weakened immune system people have with certain medical conditions, it's highly encouraged that those people should be the one who get that. That's why even in Delaware, that they lifted that restriction that you just about the age 50 and above, anybody with over 16 years of age with any underlying medical conditions can be eligible for vaccination, because those are the people that are highly at risk. And those are a couple of examples I've mentioned in the slides, like HIV, cancer patients, immunosuppressive therapy patients, transplant patients. So these are the patients that should be at high risk and should be getting the vaccination. These are also the people who should also think about, if they can get their vaccine, to ask for their healthcare provider to get serum antibody infusions, because that also do show protections against these viruses. However, it will delay your vaccination event if you do get that, as I mentioned before. A lot of talk about Guillain-Barré syndrome, which was very common with flu vaccine. Since this vaccine is not made like a flu vaccine, and it is not same as a flu vaccine, and it does not prevent flu infection, it should not be delayed because of those beliefs. Bell's palsy with the COVID-19 vaccines have been shown in some cases. However, the cases are very small, that overall benefit of the vaccines outweighs that risk. who should be cautious about these vaccines? Those are the people who have immediate allergic reaction to these vaccines and anaphylaxis right after they got the vaccine. So if you are not sure, you can talk to their provider, or you can also consult an allergist or immunologist for these for the vaccination, that where you be eligible or not. Vaccination during pregnancy and lactation. So there was a recent study that came out that pregnant women who gotten their vaccine not only protected them, the vaccine not only protected those pregnant women, but also it went through the placental barrier and also protected the babies too. So this study has been very recent, and it's showing promising that these vaccines do protect both mom and fetus. So don't be discouraged that you're pregnant and you can't have vaccine because you're pregnant. It is recommended for those people. However, because of the side effects of these vaccines that some people do get, Tylenol is recommended because ibuprofen and Motrin are not recommended in pregnancy. So Tylenol and lots of hydration and rest is recommended if you do get some some reaction to these vaccines. People same way, people who are lactating or breastfeeding the vaccine, there's not enough data. However, it does not show any kind of problem with the moms trying to breastfeed their young ones. Same things, people, should I get vaccinated if I'm pregnant or breastfeeding? The answer is yes, you should. And same thing if you're planning to have a baby, you still should get your COVID-19 vaccine because there's no fertility problems that are associated with the vaccine. Does the vaccine affect mammograms? This is the latest thing about that when I was researching the literature and I was kind of reading it, I thought would be worth mentioning. So mammograms do show, for women especially, do show the breast tissue and the lymph nodes. However, because the side they get the vaccination, it can cause transient inflammation of the lymph node, which can cause abnormal mammogram readings. So the advice is that at least wait 4 to 6 weeks before, after the vaccination, or better yet, get a mammogram before you get the vaccine to avoid that kind of false readings on the mammogram. When I was reading it, I thought that was very important to mention to women who want to keep their health risk at minimum and want to keep all their mammogram and healthcare needs pretty diligently. So I would avoid doing that. Vaccination reactions, usually you have immediate reaction, which is anaphylactic, then you have a delayed reaction, and you have reaction in between. So most people do get over these reactions. There's very little data about that vaccines cause any deaths. So most of the time, these vaccines are very safe and effective. So do get your vaccines. So like I mentioned, local reactions and systemic reactions are part of the vaccine side effects. However, they are transient and they go away very much in a week or two or a few days. So the thing that a lot of people ask, now I've got my both vaccines, do I still need to wear a mask? The CDC, the state government, and federal government, everybody do recommend wearing a mask, because even if you do get the vaccine, you still can get corona infection. However, these infections would be very short-lived and not as severe. However, if you do get infected, you still can infect other people in the household or in the community. So do wear your mask, avoid crowds, and at least do social distancing. So be mindful, not only for yourself, but others too. Current state recommendations: all Delawareans are now eligible for getting the vaccine, 50 plus. This was the big logo on the Delaware website, so I thought I'd post it in here too, so that at least everybody can see it. Currently, starting March 17, they started doing 50 plus vaccinations and 16 plus for higher to moderate risk medical conditions for people. And I did mention all these high risk and moderate risk conditions that are listed on the website. Those are the people, if you think you're one of those, are eligible to get it regardless of the age bracket. So most people with age 50 and above can get it, but people 16 and plus, because they're not 50 yet, but do they have these high risk or moderate risk conditions, are still eligible to get their vaccine. So do talk to your provider or talk to state Delaware Public Health representative to see if you can qualify and get these vaccines so that you can be safe for yourself and for others too. These are some timelines that I do want to mention, that how state is progressing for giving out vaccinations. So currently long-term care facilities and staff and healthcare workers frontline are still going on. People who has not gotten it or didn't get the chance to get it are eligible and should be encouraged to get it, and teachers, school staff, since most of the states are now opening and along with the schools are becoming hybrid and also planning on opening later on, they are also now eligible from now on until March 31st that they can get their shots. People 16 to 64 years with high to moderate risk, as I mentioned, also they are eligible too. And then you can see the later dates as you can for everybody else opening up for the vaccination. So state is trying to, because of the limited resources, trying to give the people at high risk or to get the shots first before they allow everybody or general public to have their shots. So please be mindful. Don't call the state unnecessarily, or don't call the providers unnecessarily, trying to find out when it is. The best thing would be to look at your state website to find out when you'll be eligible to get your vaccine, and then register, because all vaccines are being given by registering. So you can register at different places, which I'm going to mention for that. This is the timeline how the states is moving for vaccination deal, and what venues they're using for the vaccines, like pharmacies, vaccination events, and medical providers. These are a couple of pharmacies, and Walmart, CVS, Walgreens, Rite Aid, Sam's Club, Giant Pharmacy. All these pharmacies are vaccinating, but you have to register with the state first before they can allow you to get a vaccine. So be mindful, register on the state level at the state website, because it will let you know if you're eligible or not. And people who are not eligible, the website won't let you register fully. So, don't get discouraged. Come back later when it's your time, and then get registered and get your shots. There's some vaccination events that are being state sponsored through different venues. And one of those venues is our ISD. So April 1st, from 10 to 2 o'clock, we're having a vaccination event going on at ISD. It is very limited because we have a very limited supply of vaccines. So be mindful. It is first come, first serve. If you're having any problem registering, you have these names for assistance and their phone numbers. These guys are very helpful, and they will help you register. If you are not registration eligible or vaccine eligible, they'll let you know if you're eligible or not. They don't have any saying in who can get registered and who not, because it's going to be state deciding that who's eligible and who's not. So be respectful, and then if you don't know, you can always call these numbers to get registered. Like I said, the vaccines are limited, so whoever register first will be eligible to get their shots. Once we ran out of all the shots, there won't be any more available. There's also a second date too, which we'll announce later on for the second shot vaccine. Okay. So some providers, like I mentioned, are also giving shots. However, they're only going by what the state registered people, state is calling them, basically telling that the people who should get those shots through them who have been registered online. Please don't call the providers directly, because they won't give it. They won't give you the shots without being registered online. These are some helpful numbers that if you want to know about what can you do about how to get a vaccine, or what is going on with certain vaccines, or if you had any certain problem or side effect from the vaccine, please do call these numbers. These people are highly knowledgeable, and they've been dealing with the public, so they'll guide you in the right direction. So I thought I'll mention these numbers in bold so that you can use them. To get an appointment or register for the vaccine, these are the websites that you can use. Each pharmacy, like I showed you, CVS, Walgreens, Rite Aid, Giant, have a link that's going to lead you to the top link, basically taking you back to the state registration site so that you can register properly. So vaccination events, you can, if you think you have enough people that need vaccines, you can use this vaccination event resource. So like we did with the ISD, we called the state to allocate some vaccines to create an event for us. You can also call this number for your entity to get yourself vaccination events arranged for your people or jobs, at companies. So that can still be done. However, the resources are limited, so they may or may not be able to do that for you. However, it's worth trying. Certain medical providers, like I said, they are also providing. However, they can't give you vaccine without being registered. So again, register. So in a recap, who is eligible to get the vaccine right now? It's 50 plus years old, healthcare workers, long-term care facility like nursing homes, their staff and residents. If you work in those, you can are also eligible. Frontline workers, people with who are aged between 16 to 64 and high to moderate risk, as I mentioned earlier. Frontline workers, as I mentioned, and anybody who previously in the previous phases has not received it, they are still eligible to get their vaccine. Dr. Salim has shared a fun fact about that. Companies that bought hand sanitizer, mask, and PPP equipment, like for their employees and stuff or themselves, are eligible for IRS medical benefit tax deduction. So people who owns business, this may be helpful. If they didn't know that, they can apply for as a deduction these PPP products. So I thought I'll share that so that even people who own some businesses can benefit from a current situation. So like I said, in order to live safely, we have to still wear masks, face coverings, still practice social distancing and wash your hands and sanitize the surfaces, despite even getting a vaccine or not. These should be continued to be followed. And if you're sick and you think you may be having symptoms related to corona, please stay home. Don't go out in public and infect others. That's how this pandemic started. So be mindful and be a good human being. This is the last slide. I'm going to leave it up for everybody to view it so that they'll know and mark down the date and time for our ISD vaccination event. With that, I'm going to open up for questions.
Jazakallah khair, Dr. Khan, for that beautiful, beautiful presentation and all that great information. I am currently looking at the comment section. There are no questions.
Well, that's good.
Alhamdulillah. So thank you for reviewing those frequently asked questions and tackling them in the presentation. With that being said, I will now end the live stream. Jazakumullah khair. Any last words, Dr. Khan?
I'm just going to say that, there's a lot of myths floating around this vaccine and, how quickly it was made and what might be the side effects that people are not telling who are giving the shots to everybody. So those concerns are legit. However, these vaccines weren't produced overnight. They were produced a little bit quicker than most vaccines. However, they went through, clinical trials, and they won't pass anything that is dangerous to the general public. So keep that in mind. Also, vaccine and Ramadan, so you can get a vaccine in Ramadan, and it won't break your fast. The other thing is that the contents in the vaccine does not have any gelatin, pork, or preservatives that a lot of people have concerns about. And then, by getting these and encouraging others, I think if we get everybody vaccinated, we won't be having a pandemic anymore. So, in order for safety of ours and everybody else, I think we should get vaccinated as early as possible. And I would encourage everybody to join and encourage everybody else. And by this presentation, find themselves armed with enough knowledge to tell the other people who do not want to get vaccinated or who have a lot of questions about vaccinations to answer them properly to their satisfaction and help join the revolution by getting over this pandemic. All right, and that's about I'm going to say, but I wish everybody have a happy, safe, and healthy this year and time to come.
Shukran. Assalamu alaikum, everyone.
Wa alaikum.